Incorporating telemedicine for community benefit in India. If you are a student of community medicine or preventive social medicine or public health, or maybe you are a policy maker, or maybe even you are just a clinical practitioner, today's topic is going to be very helpful, particularly talking about the use of telemedicine for the community health. Hi, my name is Dr. Nitin, and if you are new to this channel, please subscribe to this channel where I share various tips, tutorial ideas, and strategies related to growing your clinical practice, making every day better for a doctor. So, without further delay, let's get started with today's topic. And I hope you have already subscribed. So, get started with today's topic. So, telemedicine, it has emerged as a vital tool for enhancing the healthcare access, particularly in the rural and underserved areas in the developing nations like India. So, this integration of telemedicine into the healthcare system, the existing healthcare system, it promises various benefits, which includes like improved patient outcomes, reduce healthcare costs, and increase accessibility to medical services. So let's understand what is the current landscape of telemedicine in India. So if you are already working into telemedicine in India, let me know like how and what role you are into. So to begin with, it provides uh, the access. So India faces a significant healthcare disparity, uh, where approximately 69 to 70% of its population is still residing in rural areas where the medical facilities are very sparse or almost negligible, bare minimum. And about 75% of doctors, they practice in urban settings. So this is worsening the healthcare divide between the urban and rural healthcare access in India. So telemedicine can bring and bridge this gap by providing the remote consultations and access to specialist care to the patient who would otherwise need to travel a long distance for treatment to the urban areas. Also, you can observe some government initiatives. The Indian government, it has recognized the potential of telemedicine. It was very late, but now they have accepted. And through various initiatives, including the Ayushman Bharat scheme, government is aiming to achieve universal health coverage by the year 2030. Okay, so this includes particularly integrating telemedicine services into the health and wellness centers, also known as HWCS, across various rural areas. So organizations like ISRO, that is Indian Space Research Organization, they have pioneered telemedicine projects long back in 2001, helping to link the urban hospitals with the rural clinics in order to facilitate better healthcare delivery. So there are various benefits of telemedicine. The first one is very critical, that is cost effectiveness. The telemedicine reduces the travel expenses for the patients, which is particularly beneficial for those patients who are living in the remote or rural areas. So it basically minimizes the need for longer trips to urban hospitals, thereby lowering the overall healthcare cost for those uh, patients, remote patients. Second one is the timely access to the care. So patients can receive quicker consultations and follow care through telehealth services. And this is very crucial, my dear friends. It is very crucial during emergencies and pandemics also. We can discuss it more detail, but it has shown that improved health outcomes also. So there are numerous studies which indicates that telemedicine can lead to better management of various chronic conditions, particularly like diabetes and hypertension or high BP, facilitating regular monitoring and consultations. So there are certain challenges and considerations also. Uh, Despite the potential of the telemedicine, there are several challenges which is stopping the widespread adoption of telemedicine in India. To begin with, obviously, the first challenge is the technological challenges, the technological barriers. There is limited internet connectivity and lack of technological literacy. We are not talking about the urban setting, we are talking majorly about the rural population. The availability of mere just presence of internet data is does not solve this problem. That acceptability has to come there. So which is hindering the access to this kind of telehealth services. So investments into this kind of infrastructure and education is very crucial or very essential to overcome these barriers, particularly technological. Then there is this regulatory frameworks. There are limited or absence of clear guidelines, which has created some kind of uncertainty in the healthcare providers regarding the practice of telemedicine. So this Medical Council of India, they have introduced guidelines to standardize telehealth, telemedicine practices, but the ongoing education and training is also essential for effective implementation. A guideline is there, but implementation is not there. There are some data privacy concerns, like ensuring the patient confidentiality and data security. It remains a significant concern, and that must be addressed in order to build the trust in the telemedicine services. So, if you are planning to work in this, there are certain future directions where you can work on in order to maximize the benefits of telemedicine, particularly for the community health in India. So, there are several strategies that can be employed. To begin with, you can focus on enhancing the infrastructure, improving the internet access, and providing the devices like smartphones or tablets to community health centers can facilitate telehealth services. Then training the healthcare providers. Yes, we need to train the healthcare providers also, so that continuing the education programs on this kind of telemedicine practices will equip healthcare workers with the necessary skills to provide effective and remote care. We need to create some public awareness campaigns, educating the communities, patients about the availability and the benefits of telemedicine. It can increase the acceptance and the utilization of this kind of services. So, to conclude, what I would like to say is that by incorporating the telemedicine into India's the overall healthcare system can significantly promise for enhancing any kind of community health outcomes, particularly in the rural areas. So, by addressing these existing challenges and leveraging the technology effectively, the India that we are talking about can move toward a more equitable healthcare system, which will benefit not just only urban but the rural citizens of India also. So, if you found this information useful, please like this video and share with others. If you have any questions or if you want to share any feedback, any thoughts you want to, you can let me know in the comment section. And please do subscribe, because when you subscribe, it helps me to understand that I am reaching to the doctors and the medical students so that they can implement this learning in their clinical practice, in their job, in their business setting. So that's all for now. This is Dr. Nitin signing out. Bye bye.